Okay, we're live. There we go. Okay, good morning, everyone. Hi, Facebook. I'm Andrea Tarr. I'm the program director at SCAN.
Good morning. I'm Marybeth Kwapniewski. I'm the program coordinator at SCAN. Thank you for joining us for SCAN FYI this morning. We're happy to have Cris Brown with us from Imperial Healthcare. Good morning, Cris.
Good morning. Thank you for having me.
So Cris, why don't you take a little moment of time and just tell us a little bit about yourself and your role at Imperial Healthcare.
Sure. So I am the Director of Community Outreach and Education. And what I try to do is get out to the community and try to give everyone a sense of what could possibly happen if they were to, God forbid, have a hospitalization and need subacute rehab or potentially long-term care. I try to educate not just the seniors who may need to take advantage of those services, but also the family members who a lot of times it's that Friday afternoon, they're at work, they get that phone call that mom or dad may have had a fall, or there may have been an incident that required a hospitalization. And now all of a sudden the doctor is ready to discharge, and what's your plan? Well, no one really has a plan for this because it's not something we ever want to have to plan for. So we try very hard to take the anxiety out of that process.
So one of the things that we stress at SCAN, and you just really mentioned it right now, Cris, is it's great to know about these things before you might ever need them, right? Because in the heat of the moment, it's very difficult. But this is a great opportunity, and for our listeners to understand exactly what happens at a place like Imperial Healthcare. So that's a good point. Yeah.
So Cris, how has Imperial navigated through all of the COVID crisis?
Sure. Well, physically, you just saw me take that big deep breath, because I feel like we all just need to take that big deep breath. I'm so grateful that we are on this side of it and that I now can sit and talk to you. I really, the first thing is just that it is amazing what people do in a moment of crisis. That I get the chills just even thinking about what I saw our staff do in this crisis situation. There are so many things that can be said, and we can go back and we can look and dissect, and we will, and we have. But when I look back overall, my biggest takeaway is just like a fireman that runs into the fire,
burning building.
They ran right into, the rooms and the units where they weren't sure what the outcome would be for our residents, and they weren't sure what consequences it would have for their own health. And healthcare workers, if we don't know now how important they are, I don't know when we will, because that's the biggest takeaway. So as far as our facility, and I can only speak, specifically to our facility, we did really well overall, but one loss of life from this is too many. We didn't see our first case in our facility until April 11th was our first confirmed case. Going back, we think that probably the way it made its way into not just our facility, but a lot of facilities, is that in healthcare, I don't think it's a secret that most of our hands-on caregivers don't just work one job in one building. They work multiple shifts in other facilities. So where one facility may not have had a case and another did, someone could be coming in, bringing in the virus and not knowing, because don't forget the danger of that asymptomatic carrier. And also very early on, we were still being told if we're healthy, we don't need a mask. So that combination really kind of led to, this virus getting into an environment that is just not prepared for it. I just want to make the point that a hospital has an ICU floor, a CCU floor, where they have glass enclosed reverse isolation rooms with every piece of equipment and every specialist right there, hands-on. And we know, unfortunately, that a lot of patients wound up in that scenario. When you took our facility and nursing homes in general, we're supposed to provide a home-like environment with clinical services for a stable patient who needs assistance with activities of daily living, dressing, eating, bathing, therapy, activities. So we say that is our resident's home. We cannot provide what a hospital could provide. So when the virus came in, we almost automatically turned into an ICU unit. And our nurses just stepped up in ways that I don't even know that they ever expected they would have to in a long-term care setting. So that's how things got started. Our residents did much better who were able to stay with us. Unfortunately, some residents did have to go out to the hospital, and a handful did wind up on ventilators. And sadly, we didn't see all of them return to us. So it was very hard.
Can I ask you a question? How was it
Sure,
determined which patients came to your facility? How did that get figured out?
So in March, that memo came out from the state, and I'm very torn on this topic because at face value, it looks bad. At face value, if you just read that memo and you hear everything, it looks like, these patients were forced to come to us. And yes, the hospitals who were in crisis needed their facility partners to please help and take some of these residents that we could care for with COVID. There was a caveat in the letter that did say, if you could safely isolate, if you can handle this patient, then you can't deny them due to a COVID diagnosis. No one knew really what that meant at the time. Think about how we've gone from it's from surface touch, and now it's respiratory. And just this week, I read an amazing article in Time magazine where the evidence is becoming more and more clear, that it is aerosol, and they're comparing it to like a secondhand smoke. If you're in a room and someone's smoking, watch the smoke and how it disperses.
Right.
And I always said, if there was a visual of this virus, I think people could understand it better. And I just want to say, I'm not a clinician at all. I just try to really pull my resources from clinicians and virologists. And so it was just a good comparison to think of it as secondhand smoke. So once it got in, it kind of did its thing, but we wouldn't not want to take our residents back that had COVID. So taking a new admission from the hospital, we were able to say when we couldn't do it, and we were able to say when we could. So, but I do understand how families were upset. And overall, as I said before, we're not equipped to handle that type of patient at that level. But a hospital also wouldn't discharge a patient unless they were stable. So we were able to say, no, we can't now. We don't have the ability to do what needs to be done. But then we were ready to say, we would like our patients back, and we want to try, and help you and be a good partner. So again, I understand why families were upset.
I mean, was some of that just the fact that the hospital needed the beds for the more serious people that kept coming in, right?
Exactly. Think about how fast this all happened. I know they were working on, secondary hospital sites, at different places in New Jersey, and they were still getting the testing sites going at this time. This all happened in such a condensed period of time. It just not enough could be done as quickly as it was needed. But yes, they were trying to open beds for people coming in from the community. So that was the goal of that memo.
We forget that it was such a condensed period of time, right? Looking back,
so fast.
A few months now.
Mm-hmm. Exactly.
And looking on the present, how are things looking at the present? Things
Right,
are opening up. Families, members are getting to visit.
Yeah, so we're still considered in what's called phase 0. All facilities are right now. I don't know if you know, but on August 10th, the Department of Health just put out 41 pages of guidelines that we have to put together. And there are 6 very serious attestations that the administrators have to sign that say we have done these almost about a dozen separate things. And in order for us to even consider sending our packet to the state, we have to accomplish all of these things, which include having 2 months of PPE on hand, separate from what you're currently using. And that number needs to be calculated based on the day you were using the most PPE. So there's actually a calculator that the state put out. So you have to make sure that you can attest that you have 2 months based on that number.
So you're stockpiling for just in case is what
we're stockpiling, and we're stockpiling during a time where the rest of the country is still seeing high numbers. So gloves and masks are not as difficult now. Gowns are still a little bit of an issue. Gowns were the biggest problem throughout the pandemic. So we're still acquiring our PPE. And again, we're doing it now in New Jersey while every other facility is also trying to put their stockpile together. Another thing that's important and will help is that the state is asking each facility to have a nurse whose sole responsibility is to oversee the infection control procedures. So that's
a permanent position, Cris? That's always on?
As of right now, they're looking at, sometimes it was a shared job, depending on how large your facility was. It could be a responsibility that fell under another person's job description.
Okay.
The state is asking that this be their sole responsibility now. Yeah, so that's a little bit of a change. And again, we were already in a staffing nursing shortage. And so now we just need to try and, figure out how to accomplish the things that the state is asking us to do. Overall, I think they're going to help. They're going to improve things, and we're always looking to improve for sure. The other thing we've incorporated from the very beginning was that our staff is screened before every shift, temperature taken. They have to fill out a questionnaire. We update it every week. If the governor adds or removes a state that they visited, we make that adjustment. Honestly, a nursing facility right now, I know, in general, our industry got some bad press because of what happened. Hopefully people will really look a little deeper as to, could it have been prevented in our facilities? Maybe if we had some of the other tools we needed, those numbers could have been reduced a bit. But again, any communal setting, we're seeing it now in the colleges. A communal setting is just the perfect breeding ground for this. And it's just, it's terrible to watch. It's terrible to see the damage that it can do. But now we are doing, everyone is masked now. A nursing facility is really probably one of the safest places you can be right now. There are so many measures in place. A new admission, if anyone does need to go to a rehab, what you can expect right now, you'll be put into a room by yourself for 14 days. And for 14 days, you do have to stay in your room. You'll get your care in your room, therapy in your room. Some facilities are allowing families to do some window visits. After the 14 days, then you'll be moved to another room where you can begin outdoor visits with your family. And those visits are once a week, up to 2 family members per visit. And I believe they're going up to 20 to 30 minutes per visit. So we're starting to see the light. We're starting to see the movement.
So that was actually, you answered the question really very, very well, because I was curious, what's the situation right now if you want to visit someone? So you can visit. But first of all, the thing is, when you get to a new facility, you're quarantining people for 14 days, which absolutely does make sense. I'm guessing they didn't do that before.
We started that very early on. Anyone that came back from the hospital, we even actually, one of our nurses just, great suggestion, and we jumped on it right away. We actually isolated immediately. Once the visitation in our facility stopped, we isolated our dialysis patients and any patient that was even going out for frequent doctor visits, because anyone that was exposing themselves to the community potentially could be bringing something back into the facility. So we separated those patients from the rest of the population immediately. So it's something we've been doing from quite early on.
Now, you know what? I want to ask you something. This is just kind of hit me now, because we're talking about window visits and you can be outside. And here we are, it's September. We can do this. But can you look ahead?
What's going to happen?
Yeah, what's going to happen as the weather gets chilly? And obviously we're not going to want to be outdoors.
Right. So on August 10th, when those guidelines came out, their goal was that everyone has to really have this accomplished within 2 months. So in order to submit our plan, we have to accomplish the things that are on their list. We are very actively working on that. We submit that plan to the state. The state will then let us know what phase we are allowed to enter. And phase 2 allows us to start scheduled indoor visits. So the state saw exactly what's coming. They realized the cold weather is coming. And so that's why the push is on facilities to have this plan into them no later than October 10th. So that's what we're actively working on. And I'm sure every facility is working on it because we want to see our family members reunited with their residents. It's painful for us as well. And we miss the family members. That was the hardest thing through all of this is, you know, the communication was cut down to Skype, Facebook calls, and we made hundreds and hundreds of them and kept our families in touch. But as the staff, our staff, they saw that boy, did we undervalue touch and hugs and kisses and, you know, just that feeling of connecting with another human being. So, you know, we want to get there as quickly as possible so our family members and residents can reconnect.
And obviously all facilities, not just Imperial, but all facilities are under these same guidelines. And, you know, this push to get things organized so that we can visit indoors.
Yeah.
In January, we're not going to want to be outdoors.
No,
Cris, I would assume those visits are in a controlled, I don't want to use the word control, but a set environment. They're not going into their individual apartments. They're probably maybe staying in a community room for these indoor visits once they happen.
Makes sense.
Yeah, if they're in a private room, then a family member is allowed to visit with them in the room.
Okay.
And otherwise it has to be set up in a room where we can clean in between visits.
Right.
Again, we have an amazing activity department that jumped right on this. They have a Calendly app that families go and schedule their visits in. There is a 15 to 20 minute break in between those visits for in-depth cleaning and deep cleaning of even outside chairs, tables, everything is wiped down before the next visit. And yes, of course, inside, everyone outside and inside will be masked. Part of the guidelines is that we even have to do more education with the families. So our staff members are working on a pamphlet and teaching. And so we're just, as much as we want everyone to reconnect, we also need to take every precaution that we possibly can.
I like that you're going to educate the families. I think that's an important part of it so that they understand exactly what you're doing, why you're doing it, because you're protecting them as well.
Exactly. You know, we don't want that phone call, you know, none of us do. And, you know, I also wanted to say that our staff is being tested every week. Half of us are tested on Tuesdays, half on Thursday. We have our results back within about 48 to 72 hours. I have to just give a little shout out to Robert Wood Johnson Barnabas for partnering with us on the testing. And they have just been amazing. We have, you know, they've just been a great partner to work with and have helped us make sure that we have healthy staff in the building. And we have been COVID-free for over 90 days, and I'm going to knock on some wood. Pardon me.
Well, for that, we have to
toast. Do a coffee toast.
Thank you.
Coffee toast.
Congratulations.
Thank you. It's our staff.
A big deal.
It was our staff, the entire team.
It's just not the same, is it? It's not the same. We can tell people that need to visit a loved one in a facility that you should visit, you could feel safe, it's okay.
Definitely. So on their visit, they come into our lobby, their temperature is taken, they're given a questionnaire just like our staff, just like a vendor who needs to come in, even a doctor, and they're going to fill that out. They'll wait in our lobby. Our activities staff has a walkie-talkie in the courtyard. They radio the receptionist. We send the family around to the courtyard. We have 2 separate areas that they're set up, 6 feet apart, family and resident. They have their visit, they're escorted back out, and the process will happen every time they visit, even if it's, you know, the very next day. Even people who are coming for a possible window visit are also screened first inside. Windows are closed and they can talk on a cell phone to each other, but at least they can see each other while they're speaking.
A lot of coordination.
A lot.
A lot.
Marybeth, didn't you experience a window visit with your
well, I got to the point where it was a porch visit, but I never did the window visit. Yeah, we did the porch visit. So yeah, I'm personally navigating all that stuff as well. So.
Oh, yeah. So you're seeing it firsthand.
Yep. So, but I know I can appreciate how much coordination goes behind the scenes. So good job.
Thank you.
And I think how much we're all missing, hugging, that touch. Yeah. We hopefully when this is all over and done, if you weren't a hugger then, you're going to
become one.
I think so. Yeah. I know there are a lot of questions maybe about the vaccines. There was a great town hall. I don't know if you follow any of Congressman Andy Kim in Ocean County. He had a great town hall, I believe it was 2 weeks ago, with a doctor from, I believe it was the University of Missouri, but I'm not sure. And he had a lot of good information on what he believes the timeline will be. And he was impressed with the rate that we're able to move the vaccination through the process. He said it normally takes 10 years to get through those 4 phases. So it is amazing what we've done so far. But, he was looking at possibly having that vaccine sometime after the new year, but then the challenge is going to be distribution, whether it's a 1-shot or a 2-shot process. But it was just a great town hall. If anyone wants some information specifically on that, that would be a place, to get some information that was helpful for us to kind of take back and look at.
Okay. Well, Cris, thank you for all that. But, we want to mention one other thing. Marybeth, let's talk a little bit about trivia.
Oh, yes, trivia, the fun stuff.
Right now. Big subject change, everybody. So, Marybeth, why don't you talk about that as the program coordinator?
Okay, so Cris Brown came to Andrea and I and offered an opportunity to have some fun with our SCAN family. We need some fun. And we're offering 2 trivia opportunities. One is in the afternoon, one is in the evening. And Andrea is catching me off guard and I don't have the dates in front of me. Oh, good. Okay, one of us is prepared.
So we're going to do, and by the way, we're using, the Boomer edition of Trivial Pursuit. And so let's see, we're going to have it on September, I can't even read my own. Oh, we have it on September 30th and October 14th. It's going to be Wednesday from 2 to 3. We're going to have 2 separate ones. I'll put all this information online. And then we're going to do it again in the evening because I know some people are working and, like we are, by the way. And so we're going to do it October 7 and October 21st. We're going to do it 6:30 to 7:30, an evening trivia. It'll be on Zoom. It's pure fun because we certainly all need some fun these days, right?
Definitely.
And Cris is our facilitator. Yes. Andrea and I will be there, and Cris has graciously offered some prizes. So the competitiveness can come out. Yeah, but no, it should be fun. It'll be a nice opportunity. It will be
fun. More details as time gets. First of all, I can't believe it's September.
Yes.
How did that happen? But yeah, so we have another month before this happens. So it'll be fun. We need some fun. So I think we're good. I think we gave out a lot of fantastic info, and really I just want to emphasize again, you always want to be prepared should a loved one ever need to enter a facility. So it's a great opportunity, like hearing from Cris now, so that you know what you might expect and that you know what places are out there. Imperial Healthcare is in Neptune. I'll put a link to all of their information. And if you want to reach out to Cris as well, it's always good to know about this in advance, because in the heat of the moment, if you don't make a decision that works for you, the hospital or someone else is going to make a decision. You might not get what you want. And that's not a good thing, right? So
yeah, absolutely.
We see that too often. Yeah.
So Cris Brown of Imperial Healthcare, thank you for being our guest today.
Thank you both for having me today. It was a pleasure.
Thanks, Cris.
Okay. So remember, everyone, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. That's Wednesdays, 9 o'clock. Take care, everyone. Bye, Marybeth.
Have a great day.
Have a nice day.